Professor, so this is my submission for the week 3 assignment, and this is my title page. Uh, this presentation is going to talk about a secure and compliant data transfer for high-profile patients using the case study that was provided for us in regards to David Beckham. So just to talk about the things that we will be covering in this presentation, I will start with an introduction, and then we would perform a risk analysis, identifying the threats and vulnerabilities that could arise in this kind of emergency situation. We will also discuss the different methods for data security. So basically the options that are available to us that can help keep the patient data secure. We will also discuss strategies for privacy protection, and then end with a conclusion and the references as well. For my introduction, basically, many security challenges have the potential to arise during a transfer process, especially with high-profile patients, media is involved, external parties are involved, and there's potential for unauthorized access to occur. This could present a risk to patient data and medical records. Some of the challenges that could arise include basically kind of what I said, the cyber threats, data breaches, unauthorized access, data leaks to the media that could impede on the patient's privacy and also impacts the level of patient care that is received. Some other potential threats could be unsecured communication channels, unencrypted data transmission. So basically the transfer of data without being encrypted, without having that extra layer of protection, making it easier to be accessible to people who shouldn't have access to it. We also will do the risk assessment, basically identifying threats and vulnerabilities. So there are 4 different categories here. The first being cybersecurity threats. This includes any hacking attempts or phishing attempts that could arise during the transfer or doing the transfer of data which is pretty much unsecured, not unencrypted. There could also be insider threats. This basically involves employees attempting to access and leak sensitive patient data to the media or to other parties for their own personal gain, but mostly without authorization, because not only would it be against the rules of the hospital, it would also be against the rules of HIPAA, which are in place to protect a patient's data and information, sensitive data and information. Another threat or vulnerability would be the media scrutiny. So this basically refers to the potential public exposure that could lead to leak in sensitive patient data. So if it is released that this high profile patient is in this emergency situation and they find out what hospital they're in or whatever, they're going to try their best to try and get some information on that patient. And that any information they would get would be leaked info because it shouldn't be getting out to the media. Um, Lastly, it will be emergency risk. So due to the urgency of the transfer, that could lead to a lot of oversights in terms of keeping patient data secure because they are working with limited time. Um, their priority might be getting the data transferred and not making sure the data stays secure. And also looking under the vulnerability analysis, there is like personal information sensitivity. So this has to do with personal contacts information, any treatment details, or comprehensive medical history. And there's a public interest factor as well. So there's an risk of targeted information breach and higher potential for social engineering attempts. So the principles of data minimization, this is one of the strategies that we're going to try and use to keep our data secure. This to limit any security risk and avoid data breaches. Data should be minimized when transferred. So this means only adding essential patient data requirements when transferring during the transmission process. The significant information that can be included consists of current plan of care, their treatment details, any no medical history related to the emergency, any medications that are currently taking, any known allergies that could impact their care, and also their vital signs. You can also add any emergency contract, any emergency contact information, and any requirements for their immediate care. All other personal data should be excluded to improve the security while ensuring the possibility for continuity of care. So basically removing non-essential historical medical information, performing regular audits and purge any unnecessary data, implement strict need to know access protocols, and we will get into that shortly. So, some other secure methods for data transfer has to do with using HL7 and FHIR. We can also use encrypted cloud platforms and SFTP. So with FHIR, so using direct electronic health records interfaces that allows you for real-time secure exchange of data. So using these standards and these platforms will ensure that the data that you are accessing in real time is kept secure. And these are HIPAA secured interfaces that are being used. They're encrypted and they're secure with end-to-end encryption files. So these platforms help protect stored data and ensure secure data transmission processes. Some examples would be AWS Health Lake and Microsoft Azure. SFTP, this is a secure file transfer protocol, which it requires you to use a multi-factor authentication. So that requires different levels before you can get access to that information, and it helps prevent that unauthorized access. And in terms of access control, user authorization, and data encryption, role-based, specific-based access control should be implemented to protect patient data. So if you're a healthcare provider, then you should have the one specific to that. If you're an IT service provider, or if you're a vendor contractor, you should have a different, access control. So unauthorized personnel are not able to access information that is not relevant to what they need to do. All access attempts and audit trails should be monitored for performance improvement purposes. The use of multi-factor authentication adds a layer of security to prevent breaches and leaks. And strategies for data encryption. Basically, using end-to-end encryption helps ensure only authorized users can gain access to the information. Some examples of this would be TLS 1.2 plus encryption, which can be utilized for when data is being transferred, and AES 256 encryption can be used for stored data. So these are just examples of like end-to-end encryption, softwares that can be used to help protect patient data. Another strategy would be patient consent. So to be in compliance with HIPAA, a written consent form with patient's name or legal representative should be obtained. This ensures legal compliance in cases of emergencies and prevents public disclosure by ensuring all communication channels are kept secure. Okay. So in terms of like the access roles, as I mentioned before, some primary roles would be like healthcare providers, attending physicians, any transfer coordination specialists, and then some limited access can be for administrative assistants, support staff, that kind of thing, basically. Another strategy would be awareness and staff training. Employees should be trained on the different HIPAA regulations and and security protocols. Staff should be able to recognize phishing attempts and cybersecurity threats. Any unauthorized disclosure should be giving confidential agreements with legal penalties. So this is going into how to address the media and also formulating incident response plans for situations like this. So to help manage the media inquiries, a structured approach to address the media is essential, especially regarding the high-profile patients. This should be there should be a designated and authorized spokesperson. This could be the CNO, the clinical nursing officer. It could also be the supervisor. Standards for HIPAA should be applied to the response by not disclosing any patient information. There should be pre-approved statements created to manage any relations pertaining to the public, especially because sometimes it could be with a limited time. So you already want to know what you're going to say beforehand. In the event of a data breach, an incident response plan should have been formulated, will be initiated. This would immediately notify the compliance officers of the breach, then go through a containment and investigation process for the affected data to make sure it stays secure. And then the HHS should be notified, keeping to stay within regulation, for any breaches that affect up to 500 individuals. And then improvements should be made to security during the post-incident audit season to ensure that that kind of situation doesn't happen again. And to develop this plan, you're going to need personnel in terms of IT teams, healthcare providers, and people that can help with the keeping the data secure, or installing the softwares and encryption softwares to make sure that data is kept secure, and also doing the training, the people to train staff on how to avoid phishing attempts and hacking attempts. And you're going to need the technology, like I said, the softwares, the encrypted softwares, the HIPAA standard softwares, things like that to keep data secure. And you're going to need a good budget as well to be able to afford the software, to be able to afford the improvement plans, and to be able to also train your staff and educate your staff. And this timeline could consist of week one would consist of training staff and setting up their access controls. Week two will consist of secure data systems testing, and week three will be more audits, and week four will be the implementation process. And just to conclude, in summary, risk mitigation strategies for data encryption and staying compliant are required to ensure secure transfer of patient data. Implementing these protocols would help keep patient data secure, and always make sure to have an incident response plan. And these are my references. Thank you.